So without further ado, I'd like to invite up to the stage Mr. Juan Ibarretxe from the Town Council of Bilbao in order to open this seminar. Good morning, dear friends. Good morning, all of you. Prior to starting with my presentation, I'd like to convey to you greetings from the Lord Mayor, who would have wished to be here, but he's recovering from an operation, from surgery, and this is why he's not able to, hasn't been able to attend. It would have been extremely interesting to listen to his opinions and reflections, because he's being a true leader in this COVID crisis, and he is at the lead of search for solutions to the pandemic and its consequences. A seminar was held in order to consider the different possibilities, such as coordination in order to prepare the city for the possible new crisis situation. We could spend hours analyzing what we've set up in Spain, in the Basque Country, rather in Bilbao. So I think this seminar is very timely because we're going to be approaching different cases and examples from the Basque Country and the rest of Europe. We can all learn from the different messages and ideas that will allow us to be in a better position to approach and address similar situations in the future. I'm sure that the conclusions you'll be reaching will be fruitful and extremely important to have a better prepared city. In the Basque Country, we became aware of generating interconnection links that on an institutional level in order to provide a comprehensive response as a country through coordination between public administrations and third sector entities. We came up with different programs using COVID funds and making a shared program and project with a task force and several task forces that worked right from the start in an efficient manner, with people very committed, people whom we would like to thank. And I would like to highlight social action areas, citizen protection, health, without forgetting the cooperation carried out with third sector entities. The priority was to protect everybody without exclusions, without excluding anybody by means of an early intervention. The effects of COVID have generated a health care crisis, socio-economic crisis, and educational crisis that is affecting our lives, but especially people, the most vulnerable groups of people. Institutions have had to adapt their services. As you know, Bilbao is a friendly city. It's friendly with the elderly, with children, with adolescents, with the more vulnerable. And this is the promise on which we work. We are focusing on people and their needs. Municipal social services, thanks to the Basque protection system, are developing specific interventions for prevention, early detection, and assistance and care for people at risk. People like the elderly, women, members of destructured families without income, migrants, or homeless. Now, this extraordinary situation derived from lockdown meant a readjustment of our services and priorities, and this made us make urgent decisions due to the situations that were being generated. But this also provided us with the opportunity to introduce hope by seeing that a new window, new times were coming, looking for new alternatives and new intervention strategies through more comprehensive responses. And an example of this was the so-called coordination groups with all the involved stakeholders by sharing everybody's resources, by sharing material resources, capacities, experiences, know-how, and well-doing. And I'd also like to highlight the coordinated work of the Town Council of Bilbao with education and healthcare units and sectors. Different things have been done in order to bridge and to do something about the digital gap, making sure we could help those people under exclusion. I'd like to share with you a series of brushstrokes regarding the main actions we carried out since the start of this healthcare crisis. In this situation of alarm, it was important to take care of the people, but also municipal services and workers in order to care for citizens. We had to reorganize services, spaces, intensifying the coordination of professional teams in order to ensure an optimal care. And as regards interventions, I'd like to highlight a few. This situation has directly affected the elderly. Non-desired loneliness has and is still one of our main concerns. In order to know the healthcare status and how older people were feeling and what their non-met needs were, we set up, we made 36,000 calls to elderly people. We also organized different centers. We have been given urgent income in order to prevent these situations in those services which, because of the situation, were not able to keep on operating. Day centers, carers, etc. We did a telephone follow-up in order to keep in touch with all the people and in order to satisfy their needs. Minors and their families have seen their contacts intensified in order to take care of adults in the families and also keeping psychosocial aid to more vulnerable homes. We made sure that the digital gap wouldn't be the cause of more exclusion. We organized leisure activities in the family, turning homes into a space that would strengthen families. Adults risk of lack of protection, and because of the effects of this pandemic, this has made us set up a telephone care and services, especially for vital services. With the lockdown, those families under an unstable situation saw how their income disappeared and found it difficult to survive, and this is why we had to come up with different services in order to provide these urgent aids and all these aids were possible thanks to the extraordinary funds provided by the Basque government. And Leseburu led the management of all this. And finally, I would also like to highlight the care given to the more vulnerable people in the city. The Town Council of Bilbao established a system for homes and spaces in sport facilities, in also homes used by municipal services, and day and night services were provided, thus covering basic needs such as food, dressing, Healthcare. At the end of the lockdown, 336 people had access to temporary housing through the Lenuracha project, a project that was managed by means of close cooperation between the third sector, Basque government, and the town council. Thus, we made it possible to provide services or projects that favored social integration so we expect 5 conclusions from all this. Interinstitutional cooperation between the third sector and private companies is essential in order to provide a more efficient response, thus taking care of the most vulnerable people. Social services have been considered as essential, and during this state of alarm, we've seen that direct care and direct attention is even more relevant. Being able to respond to these situations has made social services focus on covering basic needs, but ahead of us, we still have the challenge of recovering the community intervention spaces as areas where we guarantee the sustainability of life projects of people, thanks to intervention and cooperation in families and with the elderly. We've been able to provide new answers, agile, innovative answers adapted to these times, and cooperation with different welfare systems has allowed us to take care of those people who are having a tough time. But take into account the situation brought about by COVID, we have to move quickly. We have to reorganize all our services. As I said at the beginning, this situation has made us share and exchange all our tools and best practices in order to anticipate problems and to provide quick solutions. Strong leadership like that of the Basque president have been key issues in order to be able to do all this. And now we may wonder, what are we going to do? So we have the challenge to tackle the economic and social consequences of this pandemic's transcendental challenge, but at the same time, an opportunity. Coordination, collaboration, responsibility, solidarity, and a lot of work. The service of citizens are a key during this crisis in Bilbao, a city that's friendly with its people. Thank you very much for your attention. Thank you very much, Mr. Juan